It's the first thing in your morning. Bridget and Nick with you. And on the line right now, we have one of the co-founding partners of Oxford Physical Therapy, Ken Rusche on the line. Ken, how are you this morning?
Hey, I'm great. Thanks, Bridget. Nick, appreciate being on your show.
No,
No
thank you
problem.
again. If you remember, Ken was nice enough to give us kind of the rundown when Joe Burrow had his surgery on his knee. And now we're talking Tiger Woods. Obviously, extensive injuries. I mean, before we even get to will he golf again, will he walk again?
Oh, he'll definitely walk again. Yeah, I mean, this is a very, very traumatic injury. And, of course, everything's not out yet as far as what actually has been fractured in that. But, yeah, he'll definitely walk again. And, I think his possibility of playing golf will be there. But will he be able to golf at the level that he needs to be at? That's still unseen. But, we're talking about Tiger Woods. Anything can happen with Tiger Woods.
You're right. He's come
So
back
true.
from, 4 or 5 back surgeries and things like that. But just reading the details of this injury and the accident, breaking his leg in 3 places, having a rod put into his tibia, screws and stuff everywhere throughout
Muscle
that leg.
damage.
I mean, when you would see something like this, an injury, and what would be the process, or what would be one of the first things that you as a physical therapist would, go through and help, try to recover this injury?
Well, that's a great question. And like you said, the shin bone was broken in at least 2 places, and the bone protruded through the skin.
Ugh.
The outside ankle bone was broken in 2 places, and apparently that was an open fracture too, where that came through the skin. The big thing here is the foot and the ankle. There's 26 bones down there, and it says there were several ankle foot fractures, and they were pinned or screwed. So there's a lot of intricate foot motion, ankle motion that you need. So that's a whole different, entirely another problem. And of course, when a bone comes through the skin, you have a big infection risk. And the muscles within the leg were swelling, so they had to kind of cut the fascia on the outside of the muscles to let the muscles breathe, if you will, because they were swelling. So that's a risk of infection. So your first thing here is, you just got to make sure, and I'm sure he's being pumped with all kind of antibiotics to really fight any kind of infection. So, you've got a long process. You got a process of, even just being in a wheelchair, and then from the wheelchair being able to walk non-weight bearing, and then eventually putting a little bit of weight on it, and then working on your exercises, working on some easy strengthening exercises, some easy range of motion exercises to try to get some of that motion back and to see where that goes. So yes, it is. It's going to be a very, very long process. It's definitely not your typical sports injury.
No.
It's definitely a traumatic injury, and those are the ones that you see, mainly with car accidents. That's what happens.
Now, Ken, what would be the timetable? Obviously, that sounds like it could be a year plus.
Yeah, I not knowing the specifics, you've got to be looking at a year plus, just mainly because the tibia is a major weight-bearing bone of your leg, and just everything that you need to go through in that, you're looking, and that's, everything's got to go right. How will the fracture heal? If they heal right, things like that. But, the other thing that you kind of forget about is, I've seen a lot of patients that were in car wrecks, and they have injuries like this. But then in about a week or two, other things pop up. Oh, by the way, my shoulder hurts.
Yeah.
Now, in his case, oh, by the way, my back hurts. I mean, he had 5 spine surgeries. So how did that spine handle that trauma? And, of course, he feels no pain in the spine right now. But, in a couple weeks, will that spine be an issue? And will that I'm sure that's going to have to go through an entire rehab process. So, you're rehabbing the entire body. You're looking at physical therapy almost on a daily basis, 3, 4, 5 days a week. A lot of work, a lot of focus, and, just to be able to get back and to be able to walk and do the normal activities of daily living, and then slowly return into the sport that you want to play. And he'll make that decision as he goes along the process of how that's going to be. So yeah, it's a very, very long process.
Yeah, a long
Yeah.
road ahead, and we're hoping to see what happens, and hoping the best for Tiger Woods, regardless of how you feel about him. I mean, this is a horrible thing to happen to somebody. And
No, and I mean, you think of his kids and stuff like
Yeah.
that. I mean, lucky to be alive, and yeah, obviously the road to recovery going to be long, and hope that he continues to improve.
Ken, if anybody has any questions, they want to reach out to you. Maybe they're having some injury problems, or they need to get a tune-up or something. How can people get a hold of you?
Tune up.
Yeah, great. They can find us on our website, oxfordphysicaltherapy.com, and we do have direct access. So that means you do not have to see a physician. You can just make a call, make an appointment, and we can get you in. We can take a look at your injury, and we can get you started in physical therapy. So you can bypass the physician, the X-rays, the MRIs, all those kinds of things, and just come and see us, and we'll be your gatekeeper, and we'll take good care of you, and we'll get you into the right program.
Sounds great, Ken, and always great talking to you. And maybe we'll talk to you under better circumstances, I guess, at some point.
Yeah, that
Thanks,
would be
Ken,
great
so
to
much.
do often. Thank you, guys, and have a great day. I appreciate it.
You too.